good afternoon, dear professors, mentors, and colleagues. I am Miklós Keszég, and I'm a resident at Uzsoki Street Hospital, Department of Orthopedic Traumatology. And in the next couple of minutes, I would like to present my PhD progress report. So basically, I can sum it up with the following title: the two ongoing projects. So I am investigating the long-term results and complications of cartilage replacement in the hip and knee procedures. My vision about this project is to give a clinically relevant and overall picture about the consequences of the cartilage replacement surgeries, and for that I would like to use functional MRI and X-ray scores to evaluate the outcomes of the procedures. So in bullet points about my project, the first one is an investigation for two different kinds of arthroscopic procedures for a given size of osteochondral lesion, and the other one is an investigation of risk factors for revision arthroplasty procedures. My first project started in September, and with this title. So basically, I'm investigating the long-term result of mosaic osteochondral autologous transplantation versus microfracture for the treatment of medium-sized osteochondral defects. This is a systematic review and meta-analysis, and I would like to submit it in May next year. About some details about the background. Patients with such a condition has pain and therefore impaired quality of life, and this is clinically relevant because patients are in younger age, physically active, and occasionally they are even professional athletes, and therefore it's quite easy to imagine why is it important to have a fully functioning joint. And on the other hand, there is no gold standard for medium-sized osteochondral lesion, which procedure to choose. So there is overlap in indications, and with the given indication, there are two kind of procedure what can be chosen by the surgeon what to do, and our aim is to investigate which has the better long-term outcome. This is just a picture about an arthroscopic finding, how it really looks like in a clinical picture. So to sum it up, our clinical question is which arthroscopic method is to choose in medium-sized osteochondral lesion, and the clinical implication is that we would like to recommend that surgical approach, which has better clinical long-term outcome. So basically, as you can see, we are making a comparison between mosaicplasty and microfracture. And our hypothesis is that mosaicplasty has better long-term outcome. We did our systematic search in 26th of October in 3 different databases, and with a given search key, we found more than 600 articles, and we have 8 eligible full text. And we are ready to extract the data. About the second project, it started in October, and in this one we would like to investigate the risk factors, the early signs, and the preventive options of hip and knee total arthroplasty revision procedures. This is a retrospective core study from our own clinical data. About this background, this revision of arthroplasty is a pretty challenging procedure, both surgical, instrumental side, and of course for the patients as well. Just to see the difference, it's quite easy to see. The first picture is a primer prosthesis, and the other 3 is without any details, 3 different type of revision prosthesis. In the last 3 years, we made more than 10,000 primer prosthesis in our department, and almost 1,000 revision prostheses. I would like to underline it that it's not the same population as it was in the study by Salmon et al. So we are doing revision prostheses from all over the country, not just on our primary prosthesis. Just some information: the main reasons for the revision prosthesis: aseptic loosen, periprosthetic infection, and periprosthetic fractures as well. So these are questions. We would like to investigate the demographic data, the way of life, comorbidities, and what's really interesting is the prosthesis function score and the primary pre-revision and post-revision X-ray scores as well. With this retrospective study, we would like to build up for future planned revision prosthesis register. So about once more, our clinical question is what kind of factor leads to revision prosthesis, and clinical implication is that with the known risk factors, we can make modification in preoperative planning, surgical procedures, and postoperative follow-ups. Just some information about the data collection. We have for every patient this kind of clinical findings from which the data is quite easy to extract, and it's made by our anesthesiologist. Preoperatively, we would like to use the Oxford hip score and the Oxford knee score for the evaluation of the prosthesis function, and we are trying to find a musculoskeletal radiologist who are willing to make a scoring system score for our radiological findings. So thank you for your attention. The difference between optimism and pessimism is the lack of information, and if you have any kind of question, please ask it.
You see, probably I am the oldest person in the room, so I'm just asking about the age. I mean, on your first study, actually, I mean, you listed this as an important factor, I mean, age. Now, if you do surgeries in young sportmen, or somebody just went out for skiing, but in a good, whatever, and then, so a young one, and then there are different procedures. Does it apply, I mean, can you bring together these ones with those actually who fall off in the kitchen and then they get some kind of injuries? Or is this a bias in your studies? You already had the selection, so you already get the studies. So can you actually separate this? Because
yes, but
maybe that's different.
Yeah, but the main indication is not the age. The main indication, the size of the osteochondral lesion.
Yeah.
So, but yes, so basically anyone who file and have that kind of given size of osteochondral lesion, there are procedures what can be done. And on the other hand, of course, if the patient is an elder one, but maybe it's not that easy or doable to do an arthroscopic.
Collect different data from different studies. Then some of them may focus actually on elder ones, or elder people, and some others are young sportmen. And then you want to actually compare the recovery and the success rate. And maybe actually you get some trouble when you bring this together because the data clouds are actually covered to each other. So can you...
Sportsmen are basically everywhere in subgroups. So just information about for sportsmen as well. But of course for everybody who is eligible for the procedure.